Times Radio.
Henry Bonsu on Times Radio.
Yes, indeed. Now, as the NHS marks 75 years of service in just a couple of weeks, junior doctors will be striking in their longest single walkout in history. Somewhat sad juxtaposition. So I put that to Dr. Rocco Friebel, Assistant Professor of Health Policy and Director of Global Surgery Policy at the LSE, and Jason Reed, political commentator and UK lead at Young Voices. And I spoke to Dr. Rocco Friebel, first of all, and he said, look, we've got a system to revere, but it's the funding model that's in desperate need of reform.
I mean, you mentioned being envious of the NHS, and I think rightly so. I think the British people can be proud of the NHS. I mean, thinking back of how it started off after the Second World War, you know, people nowadays, if you require care, you go to the hospital, it's free at the point of access. And I think this is something to be proud of. Of course, I think you're absolutely right. We do see significant issues with the type of care, with the quality of care that is being provided in the NHS. And, you know, certainly those who are providing the care, healthcare professionals, nurses, doctors, they have really been through a tough time, especially over the last 12 years. So I would say, on balance, it's a system to be proud of, but it has a lot of areas that need improvement.
What would you say, Jason Reed, when you look at the NHS as a patient with strikes abounding here and there? Soon consultants will decide whether they want to go on strike. We've got thousands of posts empty among doctors in hospital, among GPs. I think it's 10,000 doctors, I think. And then GPs, about 4,000 vacancies. Among nurses, about 45,000. How would you diagnose the patient?
The NHS, in my view, is in ailing health, and we should put it out of its misery. It is letting us down on every possible measure, whether it's survival from cancer, whether it's waiting times for appointments, the enormous backlog, waiting times for ambulances, for A&E. The NHS underperforms pretty much every comparable healthcare system around the world, and we have to pay through the nose for it as well. I'm afraid it was designed in an age where Britain looked completely different to how it does today. It was implemented by Clement Attlee in the 1940s. We need a root and branch reform. We need to go back to the drawing board and look at it all over again, because at the moment it is not performing. And the way things are going, it's just going to get worse, and the cost is just going to continue to rise. And we can't afford it from a healthcare perspective or from an economic perspective.
But if you put before the British people, let's say you were going to the electorate in a year or so's time and told them the NHS was a sick and ailing patient, they needed radical reform, it could no longer be free at the point of need from cradle to grave, and we needed to introduce a European style, or maybe even more radically, American style system, what do you think the British people would say to you?
Well, this is the root of the problem, is that it seems to have a sort of quasi-religious status. It's almost worshipped by a lot of the British people. I don't think that the amount that British people are proud of it is bared out in the data. Of course, that's not the same thing as saying that people working on the front line, the NHS, the nurses or doctors are failing. Of course, it's not their fault. And perhaps that's what people mean when they say they're proud of the NHS, that they're proud of the people who work in it, which is fine. But the system is letting us all down. It's just not performing in the way that it should. And when it comes to free at the point of use, I think that's great. I think we should absolutely have free healthcare at the point of use. But there are lots and lots of ways to do that are much more efficient. And countless examples from around the world, whether it's in Europe or beyond. I'm a fan of the Australian model personally. There are plenty of examples of how we can deliver free at the point of use healthcare in a much more efficient way for the taxpayer and a much more effective way for patients.
All right. Dr. Friebel, you are a professor of health policy and director of the Global Surgery Policy Unit at the LSE. When you look at other systems like the Australian system or some of the continental European ones, or indeed the American one, which one do you think the British people would appreciate and perhaps tolerate if it were put before them?
So I think, first of all, I don't think the system itself, the way it's being funded, I don't personally believe that it needs to change. So whether you opt for a social insurance system as it's in place in Germany, in the Netherlands, other European countries, or a tax-based system as it is in the UK, I think ultimately it's about the question of, how is the system financed? Is there political willingness to support the system, to put the resources into the system that are actually needed to allow the system to operate efficiently. And I think what we have seen is over the last years that salaries have not increased with inflation. We have all sorts of issues that lead to the strikes that we observe right now and that you've been mentioning in this show.
And isn't that the point, Jason Reed, that even if you reconfigure and God knows how many times the NHS has been reorganised over the past 30 or 40 years, it doesn't deal with the problem that we have a shortage because of terms and conditions and pay. There are not enough people who want to be doctors at the rates of pay that the system allows at the moment, want to be nurses, want to be midwives, which is why we are raiding India, raiding Nigeria, raiding the Philippines to bring those people over here.
As much as we would love to give doctors and nurses a huge pay rise and pay them all £1 million a year, that is
nobody's asking for £1 million a year. They just want more than £14 an hour, as some junior doctors said.
No, you're absolutely right. You're absolutely right. And that's a big part also of why so many doctors and nurses are fleeing the UK to go and work in other places, such as Australia, because their healthcare systems have an element of the private sector. They incorporate an insurance model, whether it backs up the state system. There are various different ways of doing it, but it means that you have competition, you have some decentralization, you have the ability to pay the proper salaries for healthcare employees without having to keep pulling on the public purse. We already know how much taxes have been going up in this country, and still we have got, junior doctors demanding, I think at one point they were demanding a 35% pay rise, which would be a nightmare for inflation, never mind taxes. We heard from the governor of the Bank of England, Andrew Bailey, a few months ago that the government should be very, very careful with raising salaries for public sector employees. Of course, Andrew Bailey has no dog in the fight when it comes to the NHS. He's just worried about inflation. We cannot be signing off these huge pay rises, and that, even if we did, would be a sticking plaster. It would not solve the underlying problem, which is that the NHS model is outdated. It doesn't work. We need to incorporate some changes, whether that's a social insurance model like the examples that Rocco mentioned, or or like the Australian decentralized system where you have local government managing it rather than it all being so centralized like it is in this country. One of these things needs to happen. But the problem is we've got a short-termist approach where everyone just prefers to kick the can down the road. Well, we'll just throw some more money at it and hopefully that will solve the problem. And that just means the national debt keeps...
We've had an internal market that came in, 25 or so years ago. We've had clinical commissioning groups, fund holders, trusts. We have shaken the NHS from top to bottom several times. Every 5 or 10 years, we do this. And then I can imagine some of our listeners saying, you're talking about social insurance. Well, I pay national insurance. And what does that go to? Doesn't it go to the NHS?
It does, but it all goes into the same pot because it's a nationalized system. And so you have no competition. You have very little drive for innovation. You have a ballooning costs and no progress being made, and backlogs and waiting times just getting worse and worse. I'm afraid I don't agree with you that we've been changing the NHS from top to bottom. The NHS, with some tinkering at the edges, looks more or less the same as it did when it was when Beveridge came up with it and Clement Attlee introduced it in the 1940s. We have an aging population. We have a much larger population, if nothing else, than we did back then. We need a different system. We need a social insurance system that has competition in it, that enables the private sector to be able to help provide healthcare in this country, so that we don't have this social divide where the very rich can go off and have their private healthcare and be absolutely fine, and everyone else is stuck waiting months and months on the NHS waiting list.
Okay, so I've been accused of, I suppose, exaggerating the extent to which the NHS has had to be configured and reconfigured over the years. Perhaps I should plead guilty, Dr. Freeble. What say you? Is it just tinkering at the edges, or has the NHS really changed quite significantly? It just hasn't changed significantly enough.
Well, there are various points here. I think the NHS really has gone through a phase of significant change, significant innovation, significant policies that have been rolled out over the years, different consecutive governments, Labour, Conservatives, trying to tinker with the system, trying to introduce new measures that sort of raise efficiency in the system. But I think you can only raise efficiencies up to a certain point, because what we have to realize is that the system is run by the people, by the nurses, by the doctors, by the healthcare professionals. And I think unless you pay them a decent salary, that by the end of the month, they don't have to rely on food banks to actually get, food on the table. I think something is wrong with the system. And I think you can only squeeze the workforce for so much and for so long to deliver, higher levels of productivity.
But Jason says it's not about the pay per se. It's about how the NHS is organised, how it's funded, how it's run. That is the fundamental issue. It hasn't changed enough since 1948, and that is what needs to happen. But nobody is bold enough, either inside the NHS, the Department of Health and government, or outside those systems.
What we have seen, and that goes back to Jason's point about having a stronger role of the private sector in the NHS. And I mean, it was in the early 2000s that the Labour government introduced the private sector, the independent,
the PFI, Private Finance Initiative, etc.
Pardon?
The private finance, etc. The Private Finance Initiative, and all kinds of relationships with the private sector.
So in the independent treatments and the independent treatment sector to, take over some of the, demand that, the NHS hospitals were under. But the ultimate problem that I see, and, over the years, really demand and, the service provision by the independent sector has increased dramatically. I mean, just before the pandemic, I think 1 in every 10 pounds spent on the NHS went into the private sector. And the problem is the private sector draws on the same workforce. So you've mentioned how many thousands of jobs or vacancies there are in the NHS. And I think by just bringing in another player, opening up the market to the independent sector, the private sector, is not going to solve the problem.
So the fundamental problem, Jason, whatever system you have, we don't have enough people in this country who are being trained, who are qualified, or who want to do the job under the current terms and conditions. And also, we don't have a government that is willing to fund enough home students to train. Remember, there's a waiting list of home students to go into medical school and become doctors. And as a result, the universities say, OK, we'll fund our provision by bringing many more overseas students from India, particularly, or China, or Nigeria.
It's interesting you say that the government isn't willing to properly fund the NHS. I think politicians of all stripes are far too willing to fund the NHS. They keep throwing money down this pit of this broken model.
Oh, funding has changed significantly since the coalition came in. It's increased, but not by the measures many specialists say it should have since 2010.
Well, it's gone up a huge amount. If that still isn't enough for this broken model, I suggest we need to rethink the model. When it comes to pay for employees, those companies, countries rather, who pay their healthcare employees much better than we do, that's because they don't have an entirely tax-based system like we do in this country. And so it's not a surprise that we have shortages in this country and that people want more money. Of course they want more money, but where's it going to come from? It's all very well saying we should pay them better. Who's going to pay for it? We already have record high taxes. We already have people squeezed by the cost of living. I don't think we should be taking more tax money. We already have record high debt and tens of billions of pounds going on just servicing the interest for that national debt. We need to be bringing the private sector in so that we can have a properly funded healthcare system with proper competition to have more efficient provision of services. And that does include paying people in a more effective way that the market would decide rather than having the government deciding it, which clearly is not working.
So go the way of the USA?
No, not at all. This is a common mistake I think people make when it comes to healthcare debates. They seem to want to pick between either the UK or the US. I wouldn't defend the American model for a minute. I think that some of the ones that Dr. Friebel mentioned, like Germany and the Netherlands, the Australian example I've mentioned, that have a social insurance model but still deliver healthcare that's free at the point of use and does not leave people with huge debts like the American system does.
And that was Jason Reed, political commentator and UK lead at Young Voices, and Dr. Rocco Friebel, Assistant Professor of Health Policy and Director of Global Surgery Policy Unit at the LSE.